Magandang araw po muli. Pagpapatuloy po natin ang ating pag-aaral tungkol sa dugo o SWE. Number 15 na po tayo. Pagpapatuloy po natin ang blood stasis. So ang nararamdaman po dito, pag mayroong blood stasis ay stabbing, fix, or boring pain. Para po yung sinasaksak na sakit at nakapix lang sa lugar. Tapos yung po makikita natin yung complexion ng tao ay dark. Yung lips po niya purple. Pag tinignan din natin yung kanyang kuko ay purple din po yan. So kung may bleeding po, dark blood po at saka dark clots po ang makikita. Kung nagme-mens pa po yan, dark menstrual blood with dark clots po yung makikita natin. So yung tangpo niya, pag tinignan, purple po. Ganon din yung kanyang pulse, wiry, choppy, or firm. Ganun po ang ating mararamdaman. So, concomitant Western medical condition. Pag may chronic arthritis, may cardiovascular disorder, bleeding disorder, hematosplenomegaly, abdominal skin masses, paresis or paralysis. So, yung pattern identification po ay, yung pain po, locally fixed. Pag diniinan mo sa isang lugar lang po yan at masakit, continuous pain. So, pag aggravated po yan by pressure, not relieved by massage. Kaya pag diniinan yung gano'n na umaaray na sobrang masakit, yun po yun. May worsen during night time. Improve with movement, mild exercises, kasi natutulungan po yung blood para mag-circulate. So, pattern identification po nito, pain from stagnant chi is intermittent and moving pain that does not have a fixed location. So, yung pagkakaiba. So, pag may bleeding po, all types of hemorrhage or blood loss involving bruises and injuries, hard to contain or recurrent intermittently. So, due to static blood obstructing vessel, causing blood to extravasate into surrounding tissue. So, blood is characterized by dark color or clotted blood. Yan po yung ating makikita. Skin, hair coat, because blood is stagnate, sign of skin, dryness as blood fails to supply nourishment to body surface. Ayun po makikita natin na dry. Kasi wala ngang blood na nagpo-flow ng maayos. So, when blood stasis is chronic. Yan yung, ganyan po yung makikita. Pattern identification po, indication of blood stasis. So, meron siyang dry skin with dandruff and luster hair, coat that fall out easily without growing back. So, may pigmentation po siya, may red speckles, may purpura, pitage. Ano po yan? Basahin na lang po natin. Hindi ko na-google. Thickening or lichenification of skin. So, yung nakita po natin dun sa drawing kanina. Thank you po. Yun po yung mga sign ng blood stasis.
Thank you very much, Ma'am Mildred. Tuloy-tuloy po tayo. This time, we talk about na tayo sa blood, sa tongue diagnosis. Let's welcome Ma'am Teresita Sumile from Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. And now let's talk about swollen tongue sides. Deficiency of spleen, qi, and yang presents with a swollen tongue body as well as broad swelling on both sides of the middle third of the tongue. Note that the sides are swollen only in the middle of the tongue. This sign must not be confused with swollen sides that extend over the entire length of the tongue body, which signifies a disharmony of the liver. Now we have here a patient, female, 40 years old. Tongue description, slightly pale, swollen, especially middle part of the sides, slightly dry, and depression at the root. Symptoms are migraines since 9 years of age, migraines now preceding and following menstruation, severe hair loss, and panic attacks since childhood. Background to disease are family history of migraines, overwork at home and on the job, and irregular eating habits. TCM diagnosis, we have spleen chi deficiency with accumulation of dampness, blood deficiency, and essence deficiency. Okay. Next, we have a female, 25 years old. Tongue description are pale, slightly thin, middle part of the sides are swollen, and then there is white, thin, slippery coating. Symptoms are headaches, pain at the nape of the neck, pain at the nape of the neck, and then fatigue and my weight gain din po siya. Background to disease, excessive consumption of sweet foods and excessive worrying. TCM diagnosis, spleen chi and blood deficiency and accumulation of cold dampness. Frequent colds and flu must be considered within the context of weakening essence. It is often forgotten that the strength of the protective chi is not only dependent on the lung chi, but also on the kidney yin and yang, the essence and the source chi. Okay? The essence is responsible for construction of the body, while the source chi is vital in supplying the body with dynamic and warming chi. Source chi is a catalyzing force that underlies all energetic activity. Kidney yang and source chi supply the bladder with chi in order to transform the pure part of the impure fluids. The transformed fluids flow to the skin and muscles and indirectly connect with the protective chi. Now, if kidney yang is deficient, the fluids will not be transformed, resulting in malnourishment of the protective chi. Distribution of protective chi throughout the body is also influenced by the 8 extraordinary vessels, especially the governing conception, penetrating vessels, which partly act as a reservoir for the essence. Protective chi is thus rooted in the kidneys, nourished by the essence, and supported in its circulation by the source chi. Frequent colds thus not only weaken the protective chi, they also affect the essence and source chi. Okay? Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now proceed to diagnosis by interrogation, and straight from Baguio, we have Ma'am Vina Pasqua. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, mental, emotional symptoms, day 13 na po tayo at excess joy ang topic. Of course, few patients will report feeling excessively joyful. A normal state of joy is obviously hindi po ito ng sanhi ng disease. Several emotion states are included under the term of excess joy. First, it includes the sudden state of extreme elation deriving from joyful news. For example, nito yung nakapasa ng board o kaya nanalo ng loto, ganun po. This makes chi rise and expands the heart. Second, excess joy can be interpreted as a life characterized by excessive excitement and stimulation. Indeed, sabi ng author, I would say that overstimulation is the best description of excess joy. of Chinese medicine. This also causes qi to rise and naglilid po ito ng heart fire. Third, excess joy is seen in certain mental conditions such as hypomania or manic behavior. Sabi po ng author, in my experience, the main meaning of joy as an emotional cause of disease in Chinese medicine is excessive stimulation. Intended in this sense, it is common emotional cause of disease in our society with overstimulation from desire, alcohol, at saka yung drugs. Pag full pattern naman ng of the heart is most likely to cause excess joy. Kasi yung flame fire harassing the heart may cause the most severe cases of excess joy. That's seen in mental diseases such as bipolar disorder is a typical example of this. However po, yung flame fire does not necessarily always cause severe symptoms. It may be seen relatively frequently in milder forms when it causes excessive and inappropriate, yung tumatawa na po siya ng bigla-bigla or wala sa lugar. Bouts of excess joy and hyperactivity. Heart fire also may cause a permanently elated mood. So, ito po, tanda natin, flame fire harassing the heart does not always manifest with severe mental symptoms. Empty heat of the heart also may lead to excess joy and a feeling of being driven and not being able to stop. So, ito po yung summary po ng excess joy. Heart fire, excess joy, permanently elated mood, excessive laughter, mental restlessness, feeling agitated, pula po ang dila na mas mapula po sa tip, kasi nasa heart yan, and yellow coating, overflowing. Pag heart empty hit naman, excess joy, permanently elated feeling as if being driven, anxiety, propensity to be startled, so madaling magulat, mental restlessness and easiness, mainit po ang kanyang pakiramdam and bothered, red thumb, redder on the tip, walang coating, at ang pulso po ay floating, empty, and rapid. Pag phlegm fire naman, no, na harassing the heart, excess joy, mental confusion, excessive and inappropriate laughter, mental restlessness, pula po ang dila with rather swollen tip, and my heart crack with sticky yellow coating inside it. So, alam na po natin. Slippery, rapid, or slippery overflowing ang rapid pulse. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Next, we have pulse diagnosis to be presented again by Ma'am Mildred Digma. Good afternoon, Ma'am Mildred.
Good afternoon po muli. Pagpapatuloy po natin ang ating pag-aaral sa pulse diagnosis, deep pulses number 2. Hidden pulse. The hidden pulse is a more extreme version of the deep pulse. The hidden or deep lying pulse will only be felt near the bone and only when the fingers are pressed down firmly. So it must deeper than the deep pulse. So mas malalim po kasi sa may bone natin mararamdaman yun eh. You have a pressed very deeply and very attentively to your fingertips before you can feel it. It is again important to differentiate between a feeble and forceful pulse. The diagnostic significance of the hidden pulse is the same for the deep pulse, but more extreme and more serious. So more serious po yung hidden pulse. Hidden pulse pattern of imbalance. Ito po ay stagnation or is extreme yang deficiency. Yung typical combination po nito, hidden and without strength. So, severe yang deficiency or qi deficiency. Pag diniinan mo, halos wala kang mararamdaman. Hidden and forceful. Ito naman, Severe stagnation of the interior. Pag diinan mo, mararamdaman mo malakas. So, sa interior po yun, ano. Hidden and rapid. So, internal heat po yun. Hidden and slow, internal cold. Ang pumasok na sa katawan. Confined pulse. Confined pulse, which is also sometimes called a firm pulse. It is a deep, long, forceful, and hard pulse. So, it provides resistance when you press down on it. Pag pinress mo pong ganun, parang itinutulak yung fingers mo. And it lacks softness. The difference between this pulse and the full pulse is that full pulse is felt clearly in all levels. So yung confined pulse po ay nararamdaman lang to sa deepest level. So yun po yung pagkakaiba niya. When you feel a pulse that is deep and hard, it will be because there is something that is stagnating qi and blood in the vessel. So pwede po itong cold, may food stagnation or may qi stagnation, may dampness, phlegm or blood stagnation. So yun po yung mararamdaman natin ay ang confined pulse. Confined pulse, yung pattern of imbalance po niya dahil sa cold or qi stagnation, plus blood stagnation or may food stagnation. So yung typical combination po niyan, confined and slow, internal, excess cold po yan. Pag confined and choppy, blood stagnation. So thank you po.
Thank you very much, Ma'am Mildred. Next, we have differential diagnosis. Let's call on Ma'am Needs you once again, who is still vacationing in Arthritis. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. How's my audio, Doc?
Very clear po. Clear.
Hello.
Clear po ang audio. Clear, very clear.
Thank you. Welcome to Arthritis. Okay, thank you po, Doc. Welcome to our TCM Foundation number 18, Invading the lung. I think this is the last pattern for the lung. Okay? Hello? Yeah. Hello, am I clear, Doc?
Clear po, very clear.
Hello? Wind heat invading the lungs. Hello?
Yes,
Nawawala
continue lang
yata
po.
ako.
Continue lang po.
Next
Medyo
slide,
may-
please.
Okay lang po, Ma'am Nils. Very clear.
Hindi yata makita ni Ma'am Needs.
Mahina yung signal nila doon. Hindi pa niya kita yung slides. Hello, Ma'am
Parang
Needs.
Ayun, ayun siya.
Nawala siya. Anyway, okay, tayo na lang. Medyo, kanina pa siya, medyo mahina, no? We will just, okay, are you okay, ma'am? Okay po, Ma'am Needs. Hello, Ma'am Needs. Okay. So, siguro will just take over. For wind heat invading the lung, etiology, exposure to climatic wind and heat, possible weak defensive Wei Qi. Can you hear us, Ma'am Needs? Signs and symptoms: cough, fever, aversion to cold, scorching sore throat, stuffed nose without snivel, cough with yellow mucus, headache, body aches, slight sweating, thirst, swollen tonsils, slight aversion to cold. Pulse, floating and rapid. The tongue, red sides or tip. Coating may be yellow or yellowish white and thin. Treatment principle: release the exterior, expel wind heat. Acupuncture treatment: lung 10 clears lung heat, Li4 releases the exterior, clears heat. Okay na, Ma'am Nits? Yan, mahinang-mahina yung signal. Okay, ayusin muna natin, Ma'am Nits. Just, okay, Li11 releases the exterior, clears heat. Stomach 44 descends stomach chi. Lung 11 clears lung heat, just like lung 10. 214 clears heat. Bladder 12, with cupping, expels wind. 216 expels exterior wind. Gallbladder 20 expels exterior wind. SJ5 expels wind and clears heat. Lung 5 clears phlegm. Needle with drainage. For headache, we add DO20, Taiyang, and SI3. For spontaneous sweating, add Li4 and kidney 7. For nasal congestion without snivel, add Li20 and the extra point yin tongue. For scorching sore throat, we prick lung 11 to bleed. For cough with thick yellow phlegm, we add bladder 13, Li4, and lung 7. Thank you very much for listening. Yeah, mahina talaga yung signal ni Ma'am Nids. So from differential diagnosis, we continue with acupuncture patterns and practice. The topic, we are still on the topic of subcostal pain. Key points of analysis: exogenous versus internal injury. Exogenously induced subcostal pain tends to begin suddenly and be accompanied by symptoms of the exterior. So these are nausea, vomiting, jaundice, red tongue with yellow and greasy coating, and the floating and rapid or taut and rapid pulse. It is mainly due to attack on the liver and gallbladder by dampness and heat. Subcostal pain due to internal injury tends to begin gradually and has a longer course. Exterior symptoms are absent. It is mainly due to stagnation of liver qi, blood stasis, or liver yin deficiency. Qi versus blood. Subcostal pain due to qi stagnation tends to be distending in quality, does not have a fixed location, and is aggravated or ameliorated by fluctuations in the emotional state. Subcostal pain due to blood stasis tends to be stubbing or prickling and lingering in quality. It has a fixed location, is accompanied by guarding, and tends to be worse at night. Excess versus deficiency. Subcostal pain due to excess tends to begin acutely, is relatively severe, accompanied by guarding and a full and forceful pulse. It is due mainly to qi stagnation, blood stasis, or dampness heat. Of these, qi stagnation is the most common. Subcostal pain due to a deficiency illness tends to begin and develop gradually. Dull in quality, preference for pressure. Weak pulse. It is mainly due to insufficiency of essence and blood. Acupuncture treatment. For stagnant liver qi, we select liver 14, GB34, and liver 3. Use filiform needles. Apply the reducing method. For blood stasis blocking the channels, we select liver 14, GB34, and spleen 6. Use filiform needles, reducing method. Gelling of dampness heat in liver gallbladder. Select liver 14, GB34, and Sanjiao 6. Use filiform needles, reducing method. Deficiency of liver yin. Select bladder 18, bladder 23, liver 14, and spleen 6. We use the filiform needles, reinforcing. Case study. We have a 36-year-old male patient who had right-sided subcostal pain for half a year. For 1 day prior to admission, the pain suddenly became severe. It was stabbing in quality, radiating to the right shoulder and upper back. He had mild fever, urine dark yellow, feces watery, tongue coating yellow and greasy, pulse taut. Ultrasound, sun-like stones in the bile tract. Diagnosis, gelled dampness heat in the liver and the gallbladder, impeding drainage. Treatment principle, unblock the liver and the gallbladder. Thank you very much for listening. Then we go to signs and symptoms. And let's call on Ma'am Vina Pascua once again. Good afternoon ulit, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, day 89 na po tayo sa signs and symptoms at itchy eyes naman ang topic natin. Excluding invasion of external wind, itchy eyes are usually caused po ng it's either by liver fire o kaya deficiency of liver blood giving rise to liver wind. Itchy eyes in allergic rhinitis are itchy eyes which is not liver related but is related to external wind kasi po the reaction caused by the invasion of allergens mimics that of invasion of external wind. So sa liver blood deficiency tayo, slightly itchy eyes, blurred vision, flutters, dizziness, numbness or tingling of the limbs, dull pale complexion, scanty menstruation, pale tongue, at saka yung pulso po ay choppy o kaya fine. Yan po ang liver blood deficiency. Then liver yin deficiency naman. Itchy eyes, floaters, dry po ang mata, blurred vision, dizziness, numbness or tingling of the limbs, scanty din po yung menstruation, dull pale complexion, pero pula po ang pisngi, bones, weathered and brittle nails. Dry skin and hair, night sweating, normal color naman yung tongue without coating. At yung puso po ay fine or floating empty. The next po tayo ay liver fire. Pag matindi na po or grabe na po yung itchy eyes, bloodshot eyes, painful eyes, headache, pula din po yung mukha, dizziness, tinnitus, irritability, propensity to outburst of anger, thirst, bitter taste, constipation, dark urine, pula po yung dila kasi nga po fire with redder sides and dry yellow coating. Wiry at rapid po yung pulso. Then next ay heart fire. So makating mata, pula yung mata, burning sensation in the eyes, redness in the inner canthus of the eyes, palpitations, thirst, mouth and tongue ulcers, mental restlessness, feeling agitated, insomnia, dream disturbed sleep, feeling of heat, red face, better taste. Ang dila po ay pula with redder tip and yellow coating. Overflowing, rapid po ang pulso. The next naman ay liver wind. So makati pa rin ang mata, dry eyes, blurred vision, tremors, severe dizziness, tinnitus, headache, numbness of the limbs, tics, stiff, deviated, or moving tongue kasi nga wind. Wiry ang pulso. Next ay damp heat in the gallbladder, itchy eyes, discharge from the eyes, yellow complexion and eyes, blurred vision, heavy feeling in eyelids, dizziness, hypochondrial pain, fullness and distension, nausea, vomiting, inability to digest fats, tinnitus, irritability, feeling of heaviness, unilateral or bilateral thick, sticky yellow coating. At ang puso ay slippery rapid. Damp heat po yan. And then last po ay invasion of wind heat, itchy eyes with sudden onset, unbearable itching, yung parang hindi na kaya yung kate, aversion to cold, fever, cough, sore throat, stuffed or runny nose with yellow discharge, headache, body aches, slight sweating, slight thirst, swollen tonsils, yung tongue po slightly red sa sides, in the chest area, o kaya sa front part. At ang puso ay floating rapid. So, yan lang po. Thank you, doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. We now proceed to the last presentation. Let's call on Ma'am Teresita to do the presentation. Benign prostatic hyperplasia. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Benign prostatic hyperplasia. Now let's talk about identification of patterns and treatment. Part 2. Liver and kidney yin deficiency. Clinical manifestations, urinary difficulty, dark urine, frequent but scanty urination, night sweating, 5 palm heat, lower back ache, dizziness, tinnitus, and dry eyes. The tongue is without coating and the pulse is floating empty. Treatment principle, nourish liver and kidney yin, dissolve dampness from the lower burner. Points used are REN 4, kidney 13, spleen 6, liver 8, lung 7 on the left with kidney 6 on the right, REN 7, REN 3, spleen 9, bladder 32, and bladder 34. Method used is reinforcing. Explanation and acupuncture points. REN 4, kidney 3, spleen 6, and liver 8, nourish liver and kidney yin. Lung 7 and kidney 6, regulate the directing vessel and nourish yin. REN 7 nourishes yin. REN 3 and spleen 9 resolves dampness from the lower burner. Bladder 32 and bladder 34 are adjacent points to affect the prostate. Next is stasis of essence. Clinical manifestations. Urinary difficulty, decreased urinary flow, nocturia, hypogastric pain, pain in the perineum, seminal emissions, urethral discharge. Tongue is purple and the pulse is wiry, choppy, or firm. Sa prostate po, ang pulse ay wiry. And then treatment principle, invigorate blood, eliminate stasis, soften hardness, and eliminate turbidity. Points used are spleen 4 on the left with P6 on the right, liver 3, liver 1, REN 3, kidney 14, bladder 32, and bladder 34. Method used is even method. Explanation on acupuncture points. Spleen 4 and PC6 regulate the penetrating vessel, invigorate blood, and eliminate stasis of blood and essence. Liver 3 invigorates blood. Liver 1 affects the prostate. REN 3, kidney 14, and Zigong invigorate blood and eliminate stasis from the prostate. Next is liver chi stagnation with damp phlegm. Clinical manifestations, urinary difficulty, retention of urine when under stress, hypogastric distension, irritability, turbid urine, hypogastric heaviness, feeling of heaviness at the perineum. Then the tongue is red on the side, swollen with sticky coating. Pulse is slippery, wiry, and sa prostate po ay wiry. Treatment principle, soothe the liver, move chi, resolve dampness and phlegm. Points used are spleen 4 on the left with P6 on the right, liver 3, liver 5, kidney 14, ren 3, spleen 9, stomach 40, and stomach 28. Method used is even method. Spleen 4 and P6 regulate the penetrating vessel. Spleen 3 and liver 3 and liver 5 move liver chi. Kidney 14 and ren 3 move chi in the lower burner. Spleen 9, stomach 40, and stomach 28 resolve damp phlegm with the lower burner. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We would like to thank everyone for joining, and special thanks to all of our presenters. We hope that you can join us again tomorrow, same time. Good afternoon, everyone.
Thank you, Doc.